TB, 64-year-old male, admitted to the pulmonary medicine team. He has no known allergies. His past history consists of a COPD exacerbation. He lives alone with his two cats and a dog. He has a history of alcohol abuse, but he's been sober for a year. He also has type 2 diabetes and hypertension, but that's controlled with meds. He's awake and oriented and alert, but he is a little bit unmotivated. He's on 2 liters of oxygen via nasal cannula, and he needs to be on this continuously even when he's walking. It needs to be kept at 95, and that's what it's at right now, and the doctors need to be called if it gets below 89%. He needs to be ambulated QID, and he does have shortness of breath with exertion. So when he is ambulating, we need to make sure that we're monitoring his pulse ox and recording it. He gets respiratory treatment with a respiratory therapist every 6 hours. At 1500, he has an ADA diet with snacks, and he has no difficulty swallowing. Occasionally, whenever he's eating, he does want to remove his nasal cannula, but we need to discourage this because it's important that he stays on that at all times. He did have a bowel movement this morning. He is voiding with no difficulty via his urinal, and his heart rate was regular. It was last recorded as an 88, and his last blood pressure was 144/92. His range of motion is fair. His legs are a little bit weak. We need to make sure we're walking the patient QID with a wheelchair assist. And he walked 4 times yesterday, and he tolerated it really well. His pulse ox didn't fall, and it was kept level. He doesn't have any skin issues, no breakdown or anything, no wounds. He is going to be getting his ABGs drawn at noon, as well as his blood sugar. And right here in his left forearm, he has an 18 gauge PIV, normal saline locked. Doesn't have any IV drips. His daughter and his family live close by in Columbia, and she visits every evening. He is a little bit depressed. He's ready to go home and get out of here. But other than that, he doesn't have any special needs or anything. He needs to be taught how to use his rescue inhaler, and also about how he may have potential allergies to his animals at home, possibly to his cats and dogs. He is a fall risk because of his weak legs, and his last pain med was given last night. He's supposed to be getting respiratory treatments this morning. He hasn't had any visitors this morning, and the doctors haven't made their rounds yet. Is there anything you'd like to add? Nope? Okay.